Yes, please.
And start letting people in. Everybody, for those of you just joining, thank you for coming. Warm welcome. I'm really excited to be here to introduce Farokh. He's been a great friend and collaborator with Frederick Schroyens for a very long time now. And this is the first in a series of webinars showcasing the new material in Synthesis Adonis. And it seems fitting that Farokh is our first guest because of the sheer, the amount of work that has gone into his contributions to Adonis. It really can't be overstated. So yeah, thanks Farokh for your labor of love
Thank you
over
so
the
much.
last decade or more. And thanks for taking some time out in no doubt your very busy schedule today. So without any further ado, I want to hand over to Farokh, who's going to guide us through the changes he's made and show us some of the influx of new information that we've got available to us now. Okay, and just a quick housekeeping thing. If you have a question, put it in the chat. We'll come to those at the end of Farokh's presentation where we can have a few questions. Okay, thank you very much. Thanks, Farokh.
No, thank you, Luke, and thank you, the ZS Opus team, for inviting me to speak about the new program Adonis that we have. Good evening and good afternoon to everybody. I will just like to start with how my journey started in Repertory, so that you will understand exactly how I made contribution, why I made contribution, and what kind of contribution I made, and what was the need. As you all know that Repertory is an index, and this index is always going to be incomplete. And nobody can say that my repertory is complete. So somebody may be good in some chapters of homeopathy who lives in Brazil. Somebody may be good in homeopathy with some chapters who lives in America. Somebody is good in India. So we need many collaborators all over the world to contribute what they are good at. And that is the real thing, how the repertory is built. So many times one person cannot be an author of the repertory. He can be a good at a author of a clinical repertory, some small work, but a larger repertory needs at least 50 to 60 collaborators from all over the world in whatever subject they are good at, and they can contribute to the profession. So I started my journey way back in 1976. So I started with Kant's repertory because that was the only available repertory to me. Kant's repertory belongs to the logical utilitarian type. It has a logic behind its construction and utilitarian function. In the later half of 19th century, they developed two prominent schools of philosophers as Puritan group and Bonegosian school. And both groups had their own merits and demerits. So let us see this Puritan group. This Puritan group are very rigid type of strict groups, according to the repertory is merely an index of materia medica. So whatever is in the materia medica should come in the repertory. Whatever is in the proving should only come in the repertory. And there is no space for clinical symptoms to be added over here. And there is no place for generalization of symptoms over here in this Puritan group. So there is no distortion of the prover's word or symptoms, and there is no breaking up of the symptoms. So these are the very strong people whose photograph I have kept over here. Like if you see, Herring is on the top and Nair is on the right. These were the very rigid people. They only wanted what is there in the proving should come back in the repertory. So Hambel, Jar, Nair, Gentry belong to this school. But the demerits of this repertory is that the repertorial analysis is not possible with these repertories because many times you don't find the rubrics in these repertories. So let me tell you a very simple example that I had seen in those days. Suppose if I talk with a patient and patient says, I get very angry when somebody speaks lies. Very common thing, very common symptom. Well, I opened the Kent repertory and there was no rubric like that. But in my clinical practice, it's a very common rubric. And like that, I can give 100 of such examples where Kent repertory was big failure with simple situations of day-to-day life. Like somebody was very rude to me and I felt very bad. Now, sensitive to rudeness, Kent gives very few remedies. But it is such a common rubric, it should have at least 50, 60 drugs inside. But this is not possible with Kent's repertory. And that is why using Kent repertory at that time, even though it had an advantage, but there was also a great deal of disadvantage. And so slowly, I started using the thoughts of Bonegushian. I would use the word Bonegushian group. The idea was not mere indexing of symptoms, but repertories aid in clinical practice for selection of simillimum. Here the symptoms are broken up into different components like sensation, location, modality, concomitance, and are kept separate. By the last quarter of 19th century, there was flooding in the field of repertories by many small books as regional repertories, clinical repertories. Thus, the number of repertories increased up to 120. This clearly shows that profession was not satisfied with the existing type of general repertories. Puritan group was so rigid that it was impossible for these repertories to be used for clinical analysis, while therapeutic pocket book would lead to unwarranted combinations which gave no confirmations to any materia medica. Thus, a need was felt for a new repertory that could combine better aspects of these contrasting ideas. The first step in this direction was repertory to the more characteristic symptom of our materia medica by Constantine Lippi. So I started using, along with Kent's repertory, along with Bonegushian's repertory, the repertory by Constantine Lippi. This was a very useful repertory in my practice. It gave me many more new rubrics, many more new materia medica. In this repertory, modalities were given in detail. The concepts were broadened and put to maximum benefits in Kent's repertory. I still use this repertory even today in my practice. In the beginning, Kent used Bonegushian pocketbook, therapeutic pocketbook, but was soon dissatisfied with his philosophy and he started to work through the repertories published at that time. He liked the plan and arrangement of Lippy's repertory. So from 76 to 87, that was my journey, honestly. Remember, I was also using card repertory at that particular time along with Kent's repertory because of my busy practice. I wanted to repertorize the case and I had still not purchased the computer at that time. So my practice was mostly handwritten repertorization from Kent and Lippy's clinical repertory. Now, the biggest disadvantage in some parts of the rubric are overgeneralized in Kent, whereas in some other parts the rubrics are over-particularized. Like if you see the chapter of extremities in Kent, it is so much in detail, I can't tell you. Whereas mind chapter is not so much in detail. Similar rubrics with different remedies, with different evaluation is given in many chapters. This poses difficulty in working out a case because the chances of missing out a remedy are great. And the biggest disadvantage is that some remedies are overrepresented in Kent repertory, while nosodes, especially nosodes like syphilinum or medorinum, is not so much represented in Kent's repertory. So these are some of the disadvantages. Liquids taken are forced into nose, page 454. And also under nose, liquids come out through the nose on attempting to swallow. So many times, same rubric given 2 times in 2 different places with the same remedy. Certain organs are given as separate rubric without sub-rubric. This is against the philosophy and construction, like liver and region of spleen. In certain rubrics, drugs are not well represented. For example, in chapter of generalities, paralysis one side, the drug opium is not mentioned. And a better rubric for the same condition is given in the chapter extremities paralysis. So how can opium be in extremities paralysis but not there in general rubric paralysis? So these were my problems in the earlier days. A lot of printing errors, of course. These are the printer's devil. So I will not blame Kent for that. Some remedies which are not given in index represent certain rubrics. Example, Nux vomica in talk indisposed to, or Kali iodine insanity. Omission of drug in certain rubrics. So lots of error were there. So bye-bye to Kent repertory. And I started using from 1987 synthetic repertory compiled by Horst Bartel and William Clunker in 3 volumes. This was a big breakthrough in my practice. Well, volume 1 and 2 are mine and general. Volume 3, Sleep, Dreams and Sex by William Clunker. First came in German in 1973 and then Indian edition came in 1987. Now this was my main thrust of repertory. It was an extension of Kent repertory. So it was a synthesis rather than synthetic, where separate and subordinate parts to a complex whole. In this work, the author has synthesized 16 authorities and has put them together to form a complete repertory. So this was the beginning where they collected 16 authorities to join hands together and make a larger volume in the chapter of especially mind. So 1594 medicine in 4 grades. Some new rubrics in the synthetic and are not there in Kent. So these are some of the rubrics which I saw in synthetic repertory which were never there in Kent. Admiration, adulterous, affability, anarchist. The list is very long. Some new rubrics which are there: anorexia mentalis, audacity, automatism, blasphemy, blissful feeling, buoyancy, charlatan, credulous, culpability, desolate, effeminate, eloquent, exuberance, exultant, foppish, gluttony, improvident, intrigueur, irony, litigious, naive, nibble, perseverance, pompous, servile, snappish, snub, soberness, spineless, temerity, testament, usurer, vanity, and ailments from is extremely useful when I started using synthetic repertory. Additional rubrics other than in Kent's generality includes various clinical rubrics, toxicity symptoms, constitutional symptoms, modalities, prophylaxis, complexion, seasons, weather as direct rubric, and synalgia for referred pain. Clinical rubric like acetonemia, agranulocytosis, arteriosclerosis, aviator's disease, Besdow disease, Meissner's disease or sarcoidosis, Hodgkin's disease, hypertension, hypotension, myotrophy, progressive spinal Duchenne muscular atrophy, myxedema, poliomyelitis, rickets, sclerosis multiple, tuberculosis. In toxicity, I found aluminum, cautery, copper fumes, iodine, mushroom, tomine. Constitutional symptom as if in Boger plus aggravation and amelioration. Children affection, complexion, development arrested, growth in length too fast, puberty ailments in some rubrics in synthetic repertory that are present in Kent's repertory other than generalities, activity, agility, bending and turning. All the rubrics list is very large, elephantiasis, cobweb sensation, food and drinks, gait, masturbation, noises, sedentary habits, sarcoma. These are there in Kent's repertory, but 87 was a big revolution for me because the horizon was expanded, new remedies, new rubrics. It was an exciting journey to invoke all the information in my practice. And then Repertorium Homeopathicum Syntheticum, edited by Dr. Scroins in collaboration with leading homeopaths throughout the world. This was a one very big step. I would request you all to read the original foreword written by George Vithulkas and also by Dr. Scroins. It's a wonderful foreword which will tell you all the information how this repertory was formed. And that repertory was immediately linked to a software program, Rapid Aid to Drug Aim Research. And that was the known as Radar. The moment that program came to India, I think so I was the first person to purchase this software program. And when I started using it in 1986, I was in Hungary. I still will remember this day in the city of Budapest, and I was giving the seminar. Dr. Skroin was in the seminar, and he requested me to have a lunch with him. And while having lunch with him, he requested, why can't you be one of our collaborator from India and start giving your hospital information, what you see in your practice. So from 1986 to 2022, every single year I go to Belgium. I stay in the house of Dr. Scroins at least for a week, sometimes twice a year, thrice a year. We became like a family, and I started sharing my work with him. So you can understand how many years of journey we had together, sharing our information, mostly from the clinical practice. So this is how Dr. Skroin started his journey in this project of Radar. And the Hahnemann Institute from Germany printed the repertory in German language. So he basically gave a new format to the symptom at each level. And he started also using Kunzli dots in the repertory, which is very good, you know. And he tried to change the language, you know, of the rubrics. In the Kant delusion person, something hanging over the chair is sitting there, calcarea carp. That's what is written in Kant. But in synthesis, the same rubric comes as delusion person, something hanging over the chair is a person sitting there. So see the change of words. So like that, many rubrics are there in synthesis with a correction from the Kant's repertory. Time is not very long to explain every rubric, but some rubrics I have taken from and I have shown you where the correction has been made, and hundreds of them. I'm going to skip the slide little faster. So in bed, bed in, as if frozen, frozen as if. All these things have been changed in synthesis repertory. I'm going to skip it because these are just the example. And then modern American English spellings were used, checked by computers, so anemia to anemia. So all these modern American English spellings were checked. Diarrhea to this, hemorrhoids to this. So dipsomania is same as alcoholism, childbed is same as delivery after. All these things were used. Expression. Clinical rubrics were renamed coryza annual to hay fever. Skin becomes sore to decubitus. And then finally, we were working for many years to further improve the synthesis repertory. And we were stuck on Treasure Edition 2009, Veterinary Edition. And then 3,233 remedies. Number of symptoms jumped to almost 1,53,000. Author references went up to 1,599. So now we have really a big treasure in homeopathy. And let us see. The information is based on recent proving clinical experience, and the goal is to bring language of the repertory closer to the language of today's patient. Now, this is so much important. When you sit in the clinic and ask the patient, what kind of food you love, especially in children, the mother will say, my child loves fast food. Come on now, where will you see my child loves fast food? But I have a rubric of fast food in my own database. Do you follow? Or many times the person says, my husband is a big foodie. He loves food. Now we know we can look under gourmet, but there is still a difference between a gourmet and a foodie. And so we made a rubric foodie also. Then there are local desires food. Correct? Now every country has a local food. Like in Hungary, if you go, they say desire for langosh. Langosh is a sort of a bread which they deep fried in a oil, you know. Do you follow? But if you go to Japan, they have a food known as tempura. But tempura is not there in your repertory. We have desire for cheese in repertory, but we don't have desire for Gouda cheese and not for the blue cheese. We don't have a rubric aversion to blue cheese. Some people just don't like blue cheese. So all these kind of local things are not yet there in the repertory. And we have made a lot of effort to include as much as possible. When you go out for dinner, somebody will say, where you want to go? And somebody will say, I want to go where sushi is served. But desire sushi, there is no rubric, but I had made it in my database. So this is how we collected because every time, whenever there is an obstruction, wherever there is a new information and we are stuck up, there is a need for addition. And that's how we have worked for last so many years together. So new rubrics in contemporary language have been added. Family as a remedy. So it took a very long procedure for putting rubrics into family, which I did it with the help of my another assistant, Dr. Jayesh Dhingrecha. And together we did it and gave it to Dr. Frederick. So different way to visualize a rubric, allow flexibility while working. All families end with an aesthetic like Solenek, snake, lek, etc., etc. So after sharing this particular thing, we will now go to what additions I made. So let's see this. So now my journey with the repertory in the Adonis. Okay. So let me show you that. So now the biggest drawback that I saw over here is that many rubrics in the section of mind were totally absent, totally. Like Jungian rubrics was a very big area where there were no mention. because many times we see cases of mother fixation, very commonly seen in India. At least I don't know about Europe and other countries, but in India, as many times, even adults today consider their parents as a god, especially the mother figure. Do you follow? So now, where do I find such kind of a rubric, or father fixation, or Oedipus complex? So I had to study a lot of Jungian psychology for many years to understand those situations, to understand those complexes, those syndromes, give it to the patient remedies, see the results, and then finally add. So let us take this journey in the chapter of mind. So rubrics from Jungian psychology. So the most commonest one was extroverted personality. Now, it was not there. These are the people who are extremely friendly. They mix around, and this is one of the function of the ego. Carl Jung said there are 4 functions of ego. And out of 4 functions, one of the function is either the person behaves in an extroverted manner or introverted manner. Now we have a rubric introverted under reserved or introspection, but in extroverted there is no rubric. And so I had to make this rubric, and you will see that we could make 35 remedies into this over the last so many years. Then comes Oedipus complex. Everybody knows Oedipus complex, what it is. But when you see that many children, when in India the houses are very small, it's not like a British house or an American house, you know. And so many times kids see their parents making love to each other, to the by the husband and the wife, the father and the mother. And when the child sees that, over a period of time, he slowly develops Oedipus complex because he doesn't like that the father is touching my mother, kissing the mother, hugging the mother, or jumping on mother. And that's how these kind of cases came to me. They had their childhood image, childhood trauma, childhood frustration, childhood complexes. And all these stories I have mentioned in this rubric with 14 remedies so far. I'm sure this will be a very big rubric, but you should have a cure case to put it inside the repertory and not just assumption. So clinging children in mother clings to mother also can be studied along with this Oedipus complex. Electra complex are totally opposite. Huh? So Electra is father, that was mother. Only one remedy I have confirmed so far, and that is pulsatilla. Then we come to mother's complex. It's a very big thing. Now here, especially the boy tries to follow the footstep, not only footsteps, but likes and dislikes of the mother, the libido of the mother, and tries to matches that with the mother. Now here the lacticums becomes a very important thing. All the lacticums, but especially calcarea lacticum. So if you see over here, you will see the lacticum family. Then lac humanum, calcarea lacticum. Then sea animals, row 2 of periodic table, the milks. Can you see this? Series 2 and Malvaceae family. This is a very important rubric. This again needs more expansion, but each family over here, milk will give you at least 10 more remedies. So in that way, this particular rubric has got more than 70, 80 remedies. Okay. So mother fixation we studied. Authority refusing to accept. Now here, this is such a useful rubric that these people don't like to get dominated by others, or they have the very strong individuality, they have a very high ego, and they will refuse most of the authorities. And they will exactly like to do things what they desire, what they wish, what they think. Going against their wish will provoke anger. Over here you can see anger, authority against. So can you see that? Behavioral problem in children. Now this is so common. Behavioral problem in children is extremely common. Various kinds of behaviors are mentioned in textbook of pediatrics. And here you will see the most important is the metal family. If you can see over here. So this is one family which comes in a very big way. And of course other remedies are there very common like stramonium, hyoscyamus, anacardium, bufo. But this is important. And then if you see under the behavioral problem, a sub-rubric, behavioral problem children in home but good at school with strangers etc. You will see lycopodium, scorpion, thuja and tuberculum. Out of these four, three are my additions. But the most important is lycopodium. So the parents will say that, oh, in the house he is very argumentative, very angry, irritable, but with outsiders in the school, with his neighbors, he's a very good child. Emotionally blackmailing. Mummy, you don't love me. Mummy, you love my sister more than me. Mummy, you love my brother more than me. Mummy, you love my cat more than me. But you don't love me. These are all kinds of emotional blackmails. Pulsatilla is very good at. Followed by tuberculum. Okay. Then ailments from being bullied. Being bullied in university, being bullied in school is extremely commonly seen in India. Maybe in your country also. Now when somebody is bullying you, snake remedy like lachesis, nosodes like lycinum, another snake remedy like dendroaspis are extremely common. Bungerus facetiaceus, another remedy from the snake, like leoninum. I remember a case how I added like leoninum. It was a case of a lady. Now this particular lady was married in a very orthodox conservative family, and she was a Muslim lady. She was pregnant. Her husband used to work in a different country, and he used to only come once a year for 10 days to meet his wife. Otherwise the wife was staying with his brother-in-law and father-in-law. Mother-in-law had died. Now this brother-in-law wanted sexual favors from this girl, this lady, and she was refusing to give that favors to him, and so he starts bullying her, making fun of her, trying to trouble her all the time. And one fine day he hits her very hard for no reason. She complains to her husband. on phone, and the husband says it is all your fault, and my brother is extremely innocent. After that particular incident, she develops a very bad irritable bowel syndrome, for which she starts with some modern medicine but finally lands up in my hospital for homeopathy. She was a very strong-willed lady, but because she was pregnant and because she had no her support from her husband, she suppressed her feelings, her emotions, her anger, her frustration, and put everything in her stomach and intestine. And there was a long, constant history of being bullied by brother-in-law. That's how I included lac leoninum in this particular rubric. Another interesting story was lysinum story, where a child develops eczema. It was a Chinese origin child who had shifted to New York from China. The father was owning a laundry. The child was 7 years old when he shifted to New York. He joined a school where the other American boys started bullying him, and they tried to purposely hit him with a hockey stick on his leg whenever they played hockey, or whenever they played baseball or an American football. They used to push him, hit him, and they did all kind of physical harm only because he was a Chinese and not an American. So I bullied a lot. He developed a lot of anger and resentment, and that was reflected directly on his skin. I started with anacardium in this case based on his skin symptom, and later on totally cured him with lysine. The school authorities, when the parents complained, were not too much showed sympathy towards this whole situation, nor did they try to take a proper action, and that is why that brought more anger to this boy and to his own family. So this being bullied became a very important addition. Then comes neglected by father. Now these are stories and stories which I can tell about this, where how an evil father, a jealous father, an angry father, a dominating father, a violent father, an unloving father can destroy the psychology of the child. Most of these remedies have come from cancer patient stories, where cancer was much more better. And you will see that the magnesium group over here comes in a very big way. The whole magnesium group, starting from carb, sulf, mure, metallicum, phosphorus, magnesium. This is followed by another very useful remedy, and that is rhododendron. I don't know how many of you know this remedy, rhododendron, but I promise you that rhododendron has a wonderful mental symptoms if you try to study it from the repertory, and it has got some wonderful ailments from. The most important ailments from in rhododendron is that there is being feeling of neglect, especially when there is a death of the loved ones. So when there is a death of loved ones, and then there is a neglect, then that becomes a very important thing for rhododendron, and it has got lot of fears. The fear of failure is a very important rubric in rhododendron. You should remember that. And fear of losing self-control. So I would request, if you have not studied the mind of rhododendron, I think so, you should study it from the repertory. And then we have got another very important remedy over here, where you are neglected by your father, is the ammonium. Now you will see over here ammonium carb and ammonium mure. But I have some wonderful cases of renal failure, some cancer cases where ammonium was used based on the neglect by the father. Let me tell you a small story. So it was a case of a man with a diabetic nephropathy who comes to me with a high creatine level, and it was progressively increasing. And the doctors over there had advised that very soon he will end up with dialysis. He comes to me, we hear the story. The story goes like this. It's a very interesting story. When he was 7 to 8 years old, the parents got separated. And why the mother left the house? Because the mother felt that this particular man is a big womanizer, visits prostitutes, and so she didn't want the child to stay with the father. The father is a millionaire. So the father is alone, enjoying his life. He was like a bohemian life, like a Casanova type, blowing out his money on other people, but does not give any money to the son and the divorced wife. So most of his life goes in poverty. He could not educate himself much. And so after schooling, to support the mother, he does an apprentice with a company and then joins over there as a laborer and then as a supervisor, but not making much money. Whereas his father is bringing one new woman every day, spending a lot of money and enjoying. And whenever he has approached the father for money, for help, for job, for education, the father always said, "But I don't have money for you." That was the so characteristic theme of ammonium carb, I promise you. Ammonium carb, I tell you, is one of the best remedies that you should know about, because it has got maximum conflicts with the father. Ammonium carb is also a very good drug for uremia. You should remember that. And so the patient improved wonderfully well, with ammonium carb. And even today, he doesn't need dialysis, I tell you. After 6 months or so, the report started improving. The most important ailments from in ammonium carb is suppressed anger, A, childhood trauma, B, being neglected by father, C, and single parent syndrome. So remember the story of ammonium carbonicum under ailments from neglected by the father. Then neglected by the mother. That's another thing. Now here we have many drugs and many big families will come up. So column 4, Malvaceae family, milks will come, okay? And it's, see, the psychotic over here comes in a big way. But again, you will see the muriaticum part will come, ammonium mure, aurum mure, magnesium mure, natrum mure. These are some of the mure that will come over here. Now, of course, this is what Dr. Skolton had said, but in many cases, I was able to verify the findings of Dr. Ian Skolton. Now, I would rather speak on ammonium mure over here, because since carb was with the father, ammonium mure is with the mother. So if you see over here, ammonium mure, it has also got some good ailments from, and it is one of the best remedy for cancer in my practice. This is a story which I would like to share with you, and how this ammonium came. Started with one patient, but then many patients. So if you see over here in ammonium mure, the most important theme is abuse, molestation, sexual abuse, again suppressed anger, grief, mortification, and neglected by the mother. The story goes like this: breast cancer, right breast. Doctor had said that the breast is very dense on mammography, and there is grade 4 fibrosis in the breast, and it's a pre-malignant condition, so she should go for mastectomy. And she goes for biopsy, which shows carcinoma in situ, stage 1 cancer of the breast, and doctor says, please remove your breast. But she said, why should I remove my breast? I would like to try some natural things. And so she comes over here. So at 6 years, her mother's brother tried to sexually abuse her. She realizes this after 6-7 years of abuse. So the mother's brother will come every weekend and play with her genitals when mother is not there. Do you follow? And the anger keeps on building up. There is a strong anguish within her. If you see, the anger is equivalent to fire. So if you see the delusions of fire and all those things, also you will see ammonium mure in a very big way. She had a lot of grief that this is happening to her. She tried talking with her mother at a later age in her life, but mother refused to accept that my brother could do such a long thing. And that remained in her body for a very long time, till she was 40-45 years. So if you look at the rubric, there's a very nice rubric in the repertory, fear lifelong. And you will see ammonium muriaticum. She could not bear any injustice to her in any way, basically. So this was also one very important part of her psychology. And when I asked her to talk about her dreams, because dreams are very important part in the ammonium mure psychology. And she said that many times when she makes an attempt to sleep, she gets nightmares. Now, this was very important thing to know, that she suffers from nightmares, and she wakes up with those nightmares. She sometimes screams with that nightmares, and many times she feels that the animals are coming and biting her. So that kind of then many times she dreams about her father. And why she dreams about her father? Because father was dead at that time when abuse was happening, and she always felt, I wish my father was alive so that he could have, scolded my mother's brother who was trying to abuse me sexually. And but the animal biting was very important. There are many animals in the dreams of ammonium mure which bite. I think so. Horses are biting, animals are biting, poisonous animals are biting. Based on that, for next 5 years, we did the examination of the breast of that lady based on ammonium mure prescription. and the lady was doing reasonably well. There was no cancer detected in this lady. So this was one very good thing to know about the effect of this. The most important craving for ammonium mure is lemonade and alcohol. So many times they take gin and lemonade together, or they love pickles. They love sour things. They love sugary things. And they love alcohol. They love whiskey. They love gin. And they take gin with lemonade. This is how the story of a ammonium mure patient will exhibit. And then let me tell you a story of aurum mure netronatum. So how I did aurum mure netronatum, this is also I want you to know about, because here also a very big theme of a thing will come about the aurum mure netronatum in a case, again a cancer case. This was cancer of a uterus, and she was given chemotherapy. And then after chemotherapy, they wanted to remove the uterus and the ovary because she was already 62 years old. And doctor said there is no use keeping your ovary and uterus now. So after 6 chemotherapy, we will cut out your uterus. Now she was not prepared for operation. In fact, she was not prepared for chemotherapy, but the family members forced her, and that is how everything started. Anyway, she comes to us and says, I don't want to remove my uterus. Doctor says, I have a cancer. They have given me 6 therapies of chemo. But now they say operation is also needed because there are lymph nodes which are enlarged and which are not done away with chemotherapy. And these lymph nodes may be having cancerous cells and all those things. So she starts from her childhood. Mother was extremely dominating and she hated her mother. Mother always dominated her and always gave preference to her brother. Now, this is partly true in Indian society that boys are given more importance than the girls. So that kind of thing was there. And then with many family things, like many family occasions, events, she was never considered. Her opinion was never taken. In fact, when she wanted to study further, the parents said, no, you have to get married and go out of the house because the house is too small and we want your brother to get married and bring in the new wife. So you go and get married. And she said, but I don't want to get married. But the mother says, no, then I'll throw you out of the house. So that kind of honor is wounded, something like that. Honor is wounded, domination. The mother even never had a good relation with the father. So constant fight between father and mother was also there. So if you look at the rubric, discords amongst the parents, also you will see aurum mure netronatum. This is very important. So if you look at the rubric, anger towards one's own family, you will see aurum mure netronatum as a very important rubrics. And she was a very angry woman in the beginning, but she was very nice woman, always ready to help other people. But this neglect from the mother was pretty strong, and conflict with the mother was constantly there, constantly there. And many times she always feel that this world is not meant for me. So if you look under delusion unfit for the world, you will also see aurum mure netronatum. So based on that whole situation, I prescribed to this lady, and today she is almost 80 years old, maybe 20 years have passed, but there is no trace of cancer in her uterus. So what I'm trying to tell you is that the information that we have put in the Adonis is not one day story. Basically, we have seen cases, and of course, whatever addition I have made mostly comes from cancer patients and their stories and their life stories. But this is what it is. seducing desire to seduce. Now here you will see lot of remedies. Now I had one case. So here I saw that many snake remedies are there. Crotellus cascabella, Crotellus horridus, lachesis is there over here. Okay, and we have got spiders like tarantula over here. Now I had a case of a lichen planus of the vulva of a woman. She had taken lot of ointments and steroids and everything. The main complaint was scratching, itching, burning. I saw her in America for the very first time some 15 years ago. And I was talking with her. She was a divorcee. She divorced 2 times in her life. And I asked her a very simple question. What are you very good at? And she said, I'm very good at attracting males. Now, first time I heard this statement from a woman, that I am very good at attracting males. I said, but why do you have to attract males? She says, I enjoy males. I enjoy the company of male. And I like to have sex from the male of a particular type. And I said, what are those types? So she said, I only get attracted. Now, she was not an American, let me tell you. She was from Iran, an Iranian lady. But she said, I only like American men. I only like fair-skinned people. I don't like dark-skinned people. The moment I see a fair-skinned people, I start getting attracted towards them and I start seducing them. And I said, what is your modus operandi of seducing them? And she said, my clothes, my gestures, my attitude, my talk, my body language. This is how I seduce people. And then she had many other common symptoms of lachesis. So I said, can you just tell me some part of your childhood? Because childhood is very important part. And so she says that her father is a very big engineer. The mother is also in a computer world, both are highly educated. But my parents were extremely pushy. They always wanted me to become a brilliant person, a brilliant academician, and blah blah blah. And I was not much interested in studies. And I started hating studies after some time. When I was 13, 14 years old, my father divorced my mother because they had a lot of ego issues. And so I was totally into a wrong company with wrong group of friends. I was totally neglected by my mother, my father. Both of them never took interest in me. I started taking alcohol. I started taking drugs. I got pregnant many times. Then at the age of 30s, I came to my senses. I organized my life. I also took up some courses and now I am a secretary in some corporate company. So I said, what is the biggest grief, biggest disappointment in your life? And she said, my biggest disappointment is the discord between my parents, neglected by my parents, single parent syndrome, you can say that, and lot of emotional excitements, disappointment in love from relationships. So my friend, that was the symptoms of all lachesis, and lachesis cured her chronic lichenification because it's one of the incurable diseases in the field of medicine. So like that, you can see 35 remedies are there and how we edit with all the different stories. High livers. It's a very old Victorian era English word. High livers means people who really enjoy their life by alcohol, sedentary habits, good food, fatty foods, rich food, carbohydrates, nuts, and sulfur. We see lot of royalties, king, queens, royal families, rich men, they suffer from high livers. Anal fixation. Now, this is a very important thing. You all should know what is anal fixation. So, this is, of course, a Jungian psychology, and many people may not know. This is the stage of psychosexual development is described by Sigmund Freud. Do you remember that as a child, they were forced to pass the stool in the toilet and not on the bed sheet and not in the diaper and not on the clothes, and the forcing the child or controlling the child, when they grow up, they develop certain psychological problems, and that is how in future they may need some remedies for their psychological problem. So how do we fix that? How do we fix this anal fixation? So the most important remedy is Kali Carb, according to me, because there is Kali Carb, there's a lot of dogmatism. So they are very fixed in their thinking, fixed in their beliefs, very earthy people, will always look for security, and very dependent kind of people. So here you will see the group of Kali and the Silesia mixed together. So whole Kali group will come over here. Anal fixation. Many genetic disorders I have put in the Adonis, like Engelmann syndrome. Thanks to my daughter Rukshin, who works as a pediatrician in. She used to work, now she is in Singapore, but when in Bombay, she was working in Vadias Children's Hospital. And we could see many, many cases of Engelmann syndrome. And if you see over here, in Engelmann syndrome, the most important remedy is agaricus. So first of all, you should know what is Engelmann syndrome, because it comes very close to autism. And it's a genetic disorder with a delayed development, with speech and balancing problem, intellectual disability, and sometimes you get even convulsion. Now, if you, I think so, this particular drug you will also see in radar repertory also, and then from that repertory we are still continuing and adding more and more rubrics. But the very first case I saw in my life was of a agaricus child. Now I still remember that case, that the child had a multiple convulsions, and the mother had a very bad history of punishment during the pregnancy by her mother-in-law, who was very strict, and she was constantly reproaching the mother, pregnant mother. So after the birth of the child, within 6 months, the child mother noticed the development issues. The child was taken to a pediatrician, and the child was diagnosed as a Angelman syndrome. So the rubrics of punishment and reproaches were very, very common in this whole case. Plus, there were lots and lots of behavioral problem in the child. So the child was not according to the mental age, the physical age. But the most important were the fears in this case. So fear of ghosts, fear of dark, fear of water was very characteristic. And then foolish behaviors. And extremely fond of food. So if you see under the rubric foodie, you will also see agaricus. So that was the whole phenomena in which we saw this particular agaricus. And then there is another drug which I want to share the information with you, and that is nardostachys. Nardostachys is this remedy. If you look over here, it is one of the best remedy for hyperactive disorders, autism, Engelmann syndrome, and it's a new remedy. There is no materia medica of this remedy. I many times read lot of books on herbs, and from the herbs I try to make a homeopathic potency of these remedies. Helios is one company who makes it for me. Remedia is another company who makes it for me. St. George Pharmacy in India makes it for me. Weasel Laboratory makes it for me. Many laboratories make new remedies for me. So Nardo Stachys Jatamani is a very good remedy in Engelmann syndrome. So here is a big autism, and again here I use a lot of remedies. When I started using radar repertory, we had only 6 to 7 remedies in autism. Today, thanks to Dr. Scroins and the whole team of Radar Opus, we have 62 remedies. Now, aspartame is a good remedy. Aspartame for restlessness. If you cannot control restlessness, this is a very good remedy. Tuberculinum is very good remedy. And so I use also rubiola, parotitis and rubella vaccine when everything started after vaccination. So this is rubella, parotitis and rubella, rubiola and parotitis vaccine. This is another very important remedy when everything starts from there. Forgetfulness, when it is there in autism, xerophilum over here. You can look xerophilum. Then another very important remedy is helium. So if you'll see over here, there is a helium over here. Can you see them? So like that, I use lot of, when sometimes vaccination is the cause, I also use torula. Read torula from Borix Materia Medica. It clearly mentions about the side effects from the vaccination. Lawrence-Moon-Biddle syndrome. Now this was my very first case in early 90s that I treated with Baraita carb. Lawrence-Moon-Biddle syndrome is, I think so, it has got obesity. I think so, it has got epilepsy, eating disorder, cataract, so many complications you will see in Lawrence-Moon-Biddle syndrome. And I had a girl, they have also the retinitis pigmentosa and hypogonadism and mental retardation. Lovely symptoms of Baraita carb were there in the girl, and most of the dominating complaints were much better. Of course, I could not treat the retardation much, but I made this girl quite independent. She was first unable to move out of the house. She started going out of the house, sitting in a bus, sitting in a train, all on her own. and going to tuition classes, and she took up many new things after the use of Baraita cup. So Lawrence Boone-Biddle syndrome. So here you will see a very large rubric of a mental retardation. Now mental retardation you will see over here. In the initial repertory we had only 10-12 remedies. Now we have got almost 27 remedies. Again I am telling you that the remedy Nardo statues is a very important remedy over here. You can see over here Nardo statues. And of course, everybody knows the Baraita group over here. So many cases of mild to moderate mental retardation will come under this. But of course, this rubric is very small. It needs expansion. Cruzon syndrome. Again, the same thing, convulsions in Cruzon syndrome you will get. I had a child with recurrent cough and cold, recurrent tonsillitis with Cruzon syndrome, and they have a lot of deformities with the skull, and the child improved a lot symptomatically. So this is very important that you should try and help these children with homeopathic remedies. Down syndrome, everybody knows. I think so 10 remedies are too little for this syndrome. We should have at least 20-30 remedies. But since we cannot cure this syndrome with homeopathy, but we can give a good symptomatic relief. Now here, the most important remedy is DNA. So DNA is one important remedy which you should look for. It has got a very detailed proving. So please learn this proving because it is going to be very useful in pediatric practice. And it has got some wonderful symptoms. Most important is the confusion, concentration in a big way, and the characteristic ailments from is forsaken. Nobody is loving me, nobody is taking care of me. They have lots of mistakes in their professional life, so making mistakes in speaking, writing, memory always is very weak. They love to learn, they love to read, they love to do many things, but unfortunately the concentration is not very good. So this DNA is very good. Then Prader-Willi syndrome. Now, Prader-Willi syndrome is also a very important syndrome that my first case I saw in Australia, where parents consulted me for this syndrome. And this was again a girl. Now they have got a lot of learning disabilities, challenging behavior, increased appetite, skin picking, all those things were there. And here I would like to show you the very important rubric of Prader-Willi, and the remedy is somatotropin. Now, so in generals, if you open, you will see this remedy. Now, somatotropin is not proved in homeopathy. Let me tell you that. So I am just using it as a specific. Now, this particular somatotropin is somewhat like a Baraita cup. Remember that. And it improves the concentration in mentally retarded children. I'm using it in low potency, 6 potency, 12 potency. And I have found some good results, and that is why I have shared this information in the repertory for you. Then we go to Noonan's syndrome. Now we see so many Noonans, but you should have a good medical knowledge to diagnosed this Nunan. And in Nunan, you will again see that somatotropin over here plays a very good role. And it has got a lot of deformities, first of all, to begin with. So the eyes are wild set, the nose is depressed, the mouth has a deep groove, and again, same retardation and other problems. Here you will see bufo coming up very big way, and then thyroidinum. Many genetic disorder, thyroidinum and syphilinum can be used as an intercurrent remedy. Then we go to Turner syndrome. Now, Turner syndrome, is a very common syndrome that you will see over here. Again, they have got lot of deformities in their body. Wide web-like neck, low set ears, broad chest, and narrow roof of the mouth or the palate. Now here Calcarea group comes in a very big way. So Calcarea fos, Calcarea silicata, all these are very important. Then in intensive care unit, where I have worked quite a lot in my life with comatose patients, these are the group of my additions. Now, insensibility of the larynx and rattling in the larynx and with liver complaints, lung inflammations during COVID time, with meningitis. All these are very important. And you will see that carbon monoxide gas, that's very important remedy with many comatose patients that I have used and I have added. I have made a good addition of carbon monoxide gas over here. And so you will see in many rubrics this particular thing. And of course, other common remedies are there, but I have also mentioned about this COVID pneumonias with entin tart and phosphorus. You can see over here. So all these coma patients with opisthotonus and with open mouth and bloody froth, and it's very well described. Unequal pupils, accelerated respiratory rate, arrest of the respiration, so people are on mechanical ventilator. All my experience of intensive care unit I have added over here. So slow respiration. Now benzene 9 nitricum is also a very important remedy with coma with slow respiration over here. And then you got with septicemia and with uremia, so kidney failure. I use a lot of carbolic acid with uremic people who have got a very high creatine and the kidney sinking, morphinum, terebinthina over here, ammonium carb, we have already described with you in the earlier slides. Then some general rubrics in the mind. Love for car. Now we see so many children who buy car when they go to the shop Toy R Us. There's a very famous car shop, Toy R Us. And you'll see all floricums, they love car, followed by medorinum and tuberculinum. Love for computers. Now this is a small rubric. Love for computers. Very soon I'm going to add love to play with mobile phone. I think so we'll have 200, 300 remedies in that. But love for computers also, many, but you need confirmations. Or what we call as a computer buff. Conflicts with mother we have already described. Intolerant to contradiction in children. Convulsions after, that's very important in the mind chapter. Cruelty seeing your hearing in animals, that's a new thing. 32 remedies. Now we have got so many uh, animal lovers in India and all throughout the world. That again, this rubric is very, very small, very important remedy like Etusa, carcinosin, causticum, medorinum, phosphorus comes in a very big way. Delusion, he is outcast, where you will see a big, big leprosy, liliasis, stage 16, stage 14, AVs, anacardiacy, AIDS, animals, milks. This is big, big rubric. I have used it a lot in different kinds of skin disease, kidney disease, heart disease, lung disease. So this is, I have expanded this rubric. People on dialysis develop dementia because of aluminum poisoning, so alumina comes. But even zinc phos is equally a good remedy. Dementia due to Lewy bodies, very well seen, very well seen. You can mix this case with Alzheimer's. And here, let me tell you a very important remedy is corticotropinum. So corticotropinum is a very important remedy in my practice, and plumbum. These are the two things very commonly seen. Dependent on others' desire to be. So Baraita comes in a big way. Despair with the pain in abdomen, you can see so many rubrics, sub-rubrics. Despair with pain in abdomen, bladder, bone, chest, eye, face, head, stomach, teeth, everything. Okay. I have made my additions. This is good. Destructiveness in children needs enlargement of the rubric. 12 remedies are too little because we see lot of destructive children in India, but we need more confirmation to add in this particular rubrics. Love for power. Now this is also 47 remedies, but again, Nux, Mercury, Lachesis, Cuprum, Botrops, Aurum, Edemus, Sulfur, Veratrum. Stage 12 of Skolton, Series 6 of Skolton. All this comes in a very big way for love for power. Domination by others aggravate, you can see ailments from domination, and see over here 177 remedies for ailments from domination. You can see over here. We work so hard to put so many information from our cases to expand this rubric because weak people, people with low confidence, people with weak willpower always easily get dominated. Don Juan complex. So same womanizer or bohemian type of people, people who, so again a Jungian psychological word, you can say that medorinum comes in a very big way, followed by fluoric acid. Drawing inability for, drawing talent for. Very common. You see small children, some children are glued to drawing books and paper and pencil. They will not play with the mobile phone. Dyslexia, very common. Listen, see, 56 remedies. So that's the new addition which I made, dyslexia. Proving oneself need for. Carcinosin cum cuprum and anacardium are one of the best remedies in this rubric. They always need to prove themselves constantly. Fear of creeping things. Now we used to always take cockroach in the beginning, but now we have got all these new remedies, out of which phosphorus is a very important one. Fear of dark in children had very few remedies. Now I have broadened that into 15 remedies. Fear of death of loved ones. Many children come and say, I don't want my daddy to die, I don't want my mother to die. Fear of divorce. Many women express this. So they're all dependent remedies. Calcarea, Baraitaka, Pulsatilla. Faces looking at him. Hideous faces. Fear of forsaken in children, again the same thing. But borax is very important in that rubric. Fear of intimacy, Ignatia Natramur comes in a very big way. Fear of monster, I have expanded it to 15 remedies. You can see over here. Fear of rejection, very, very common. Listen. Natrum, magnesium, ignatia, aurum, staphysagra, and series tree. This is so commonly seen in young age, in pediatric age, in adults. Fear of separation children from, that comes with many parents during divorce phase. Foodie, I told you that I made a rubric. People are extremely fond of food. They love food, very close to gourmet. Forsaken by father, we have discussed. Freedom sensation of, wants freedom. Everybody loves freedom. But when this kind of feeling becomes very characteristic, very strong, think of this remedy. Gambling, desire to play lottery. So far only 3 remedies I could collect. Stock market, only 4 remedies I am able to collect. But Mercury is very important amongst them. Love for gardening, puts finger around the umbilicus, a new gesture which I made. Picking the skin around the nails, I expanded it to 14 remedies. Food greed for bulimia. Then I made a big rubric of bulimia with 162 remedies. Hiding emotions, look under emotion suppress. So hiding emotions, ailments from suppression, conflicts resolve, unable to. All this I put, and you will see Ranunculus family, Rosaceae family in a very big way. Hippie cultures in early 60s, but there are still many people who believe in this culture, so cannabis comes in a big way. Insanity in tuberculosis or mental problems in tuberculosis. Intellectual children, a new rubric I made. Jealousy between girls, very common. I think so it should have more remedies. Laid back, relaxed. Now in that, iridium metallicum and opium are very important remedies. Looked at cannot bear to be looked at in children. So I've expanded this already existing rubric. Love for family. Now this was a very, very first Jungian rubric I made years back. We never had this rubric. And you will see milk remedies, Malvaceae, Texas Baccata, series 3, column 4. Love things forbidden, Medorinum. Lacking of love in one's life. Now here you will see Macmure. Very strong, magnesium carb, the whole magnesium group. Mannish behavior in women. Masking emotions. People who hide their emotions, do not show their real emotion, wear a mask. Like Veratrum is very strong, Thuja is very strong in that rubric. Maternal instinct exaggerated, overprotective mothers. Column 4, milk remedies. Calcarea. Transient global amnesia, another disease which is very close to Alzheimer's. Mildness in children. mood alternating in children, mood repulsive, done for him despite that everything is belladonna, mood repulsive, everything offered to him, playing things his favorite with violence, so made a very big new rubric. Morgellons disease. Now, this is also very commonly seen in a pediatric hospital where you see skin rashes, difficulty in concentrating, depression comes in a big way. Remedies like picric acid, Pulex, coca, cocaine are very important thing to see in such people. Uh, it usually comes with a tick-borne bacterial infection. This disease is very similar to Lyme's disease. Let me tell you that. Mysticism, people who believe in astrology, face reading, aura reading, palmistry, all this occultism. They love to visit all such people, shamans. Narcissism, loving your own self, platina, palladium, Cantharis agaricus. In head, cerebral anoxia, carbonium hydrogenacetum, vanadium. Atrophy of brain, we made 57 remedies in that. Hemorrhage in the brain, we made 14 remedies, mostly snake remedies. Hemorrhage in the brain accompanied by headache, we made a big addition of 20 remedies. Increased intracranial pressure, now leading to hydrocephalus. Zinc is very important, conium cicuta. In abdomen, celiac disease, ascites, cirrhosis with alcoholics, abdomen pain operation after ovariohysterectomy, staphysagria hypericum. In extremities, we made osteoarthritis. In skin, I made a larger rubric of vitiligo. In cancer, I added more and more remedies because that's my profession. So I made cancer of the brain to 67 remedies, cancer of the thyroid to 24 remedies, esophagus, colon, pancreas, sigmoid flexure, cancer in general, 92 remedies, bladder cancer, kidney cancer, cancer of prostate, ovaries, lungs, plus their sub-rubrics. Too many. Cancer metastasis. You can see over here. In generals, microscopic polyangiitis, a new syndrome which I could add. Sensory processing disorder or sensory integration disorder, very common in pediatric age group, where plumbum, stramonium and camphor becomes very characteristic. Autoimmune disease, collagen disease, AIDS. Now I did some local Indian food desires. So desire for vada pav, where magnesium and aluminum comes in a way, medorinum comes in a big way. Laboratory findings, platelets decrease, prothrombin, procalcitonin level increase, which indicates severe infection. ESR increase, sperm count absent, sperm count low, motility low, Landau-Kleffler syndrome. So Landau-Kleffner syndrome also, you will see remedies like lycopodium coming in a very big way. It's a rare childhood disorder with loss of language comprehension. So a lot of speech problem are there, and that's why lachesis comes very strongly over here. Leukocytosis, D-dimer test is very high or positive. Interleukin 6 is increased. This we could only make during COVID endemic. Liver enzymes are increased. So these are some of the additions, not all. In 1.5 hours, I've tried to cover as much as possible. So please, I would say that Karina Servins Kellenbach, can we get PowerPoint? We will make the Zoom recording available, but not the PowerPoint.
Hi, Farokh. Yeah, I have answered most of the questions in the chat there.
So where I should start from? Can you explain the criteria for grading? Yeah. So you will see most of the remedies are made 1 marks only and not 3 and 4 marks, honestly, because unless you don't have 20, 30 cases, we can't give higher marks. So most of my additions you will see in 1 marks, unless I have seen more than 10, 12 cases. I would not like to give higher degrees. We need more confirmations to give higher marks, and I am very stingy in that. Till the time I don't find good results, I don't want to risk somebody's prescription. Look, no. Look, the link will check. How much to buy Adonis?
Hi, Farokh, can you hear me?
Yeah.
Hi, yeah, I have. We've gone through the chat and I have answered
everything. Good. So what I have to answer?
Well, if anyone has a quick question now,
okay,
then please put it in the chat.
Okay, then please put.
But wow, what a lot of work. And, you know, I, for one, have a lot of appreciation for having this, having it so easily available now in synthesis. And yeah, thank you. And thanks for sharing your time.
Thank you. So thank you very much. I think so. I don't have any questions now.
No, just lots of people saying thank you. And
okay, thank you to all of you. It is because of your love and encouragement that I could do so much work. Thanks to Dr. Schreins and his team. Thanks to Marco. Thanks to Luke. And thanks to the whole team of Opus and Adonis, that we all can work together. A single person cannot do so many things in life. As I said in the beginning, we need a larger audience to give their inputs. And God bless you all. That's what I would say. God bless. Thank you so much.
Thank you, Farokh. That's a lovely message to end on. So,
thank you.
Thanks again. We'll see you soon.
Thank you, Farokh.
Thank you. Thank you.
Thanks, everybody.
Bye-bye.
Bye. We'll post the recording soon.
Hi, Marco.
Thank you very much.
How are you, dear Farokh? Are you well?
I'm well. I'm well. I'm very well. Bye-bye.
Thank you.
Love you.
Thank you very much for the webinar today.
Oh, my pleasure. My pleasure.
You know, I'm not a fully trained homeopath, but I really did appreciate everything that was mentioned, and it's fascinating, like Luke said, to see the amount of work and details that has gone into this. It's such a massive help for professionals. So thank you.
Thank you. Bye. God bless you all. Bye-bye.
Thank you.
Bye-bye.
Thank you, Dr. Master. It was a huge work. Thank you so much. Bye.
Bye-bye. Love you. Love you all. Love you all.
Thank you.
Lovely. Okay, thanks, everyone. Bye for now.